Welcome to Movember. It's Men's Health Month.
So stay tuned so we talk about the things that every man needs to know. And there's another subject we wanted to bring up today as well that I think is really important for men, which is erectile dysfunction. And that is separate from prostate. You know, that is a completely separate subject from
Although
the prostate.
they can coexist.
They can coexist, absolutely. And, you know, very sensitive subject. You know, understandably, you know, a lot of men do not like bringing that subject up to their doctors. But, you know, and, you know, there are a lot of great therapies, and there can be different reasons why erectile dysfunction might come up. There can be cardiovascular reasons. In fact, that is probably one of the top ones, that there's decreased blood flow. And so just basically not able to maintain, you know, and that could be pretty common in someone who maybe is, you know, can get an erection but can't maintain it, right? There can be neurological reasons as well, and that's something that if, you know, that might be more common if you've had surgery, you know, in that area. Or a prostate issue, you know, something that's impinging.
And they're psychological as well. So really it's about evaluating, you know.
Yeah.
You know, we always, you know, right off the bat want to start ruling out those physiologic causes. And really interesting study in 2016 that was showing that homocysteine, which is a marker of vascular inflammation, that's an early indicator of Alzheimer's, is also one of the most relevant early indicators of erectile dysfunction. So it's back, I did a little short on it about getting your homocysteine checked. And,
check it out.
And it actually, you know, it's something that can be looked at, you know, early on and lowered, and might actually help, you know, men to have a longer, more satisfying sex life if they, you know, are able to.
And that comes back to kind of like cardiovascular, you know, protection and optimization in that area, because again, you know, it's actually what they found that if a man is having erectile dysfunction due to cardiovascular issues, meaning like decreased blood flow, it is a guarantee that there is plaque in other areas, that there is cardiovascular risk. It's a guarantee. So
absolutely.
Yeah. So that means, like, even just because you're not experiencing chest pain, you know, or shortness of breath, or, you know, twinges of pain in your chest, it is there, and it is a global issue for you that really, you know, again, you know, so many good things for reducing cardiovascular, you know.
And you know, that's an interesting topic too, because there's this catch-22 in the medical world about cardiovascular health.
Right.
And that is that most people with high cholesterol, even just, you know, on the line or moderately elevated now in the conventional medicine world, are put on statin drugs. Now, statin drugs, you know, I'm not going to say whether they're good or bad, but I'm going to tell you one thing is that they work on your body's synthesis of cholesterol. That's how statins work. But there's many, many other hormones, steroid hormones, that are on that same pathway. And when we cut off the synthesis of cholesterol, we cut down our body's ability to synthesize those other hormones, and one of those hormones is testosterone. So it's not uncommon for a man to get on a statin drug for cardiovascular health or high cholesterol, and suddenly have a drop in his testosterone, and therefore a drop in libido or erectile function.
Right.
And so it's this, you know, it's kind of this vicious circle. So I've had many men who come in, you know, I see their wives often, and their wives suddenly, you know, say, I really want my husband to come see you, you know, and they come in and, you know, we check their testosterone. I ask them, are you on a statin? And we check their testosterone, and it's often very low. So I just like to bring that up just so people are aware that that is a potential side effect of a cardiovascular medication.
And there are other options. Of course, talk with your doctor, you know, come talk with us. There are other options to control cholesterol that do not work on that same pathway of inhibition, and can be very effective, you know, so especially if testosterone is an issue.
Yeah, so we want to treat symptoms without compromising quality of life.
Right,
ultimately.
right. So coming back to like now, maybe the more fun part of the treatment treatment of erectile dysfunction, a lot of people know about Viagra and Cialis, and they work on just opening up blood flow. That's how they work. So there are natural things that do that too, like L-arginine is one of those things. And actually, there can be topicals that have similar mechanisms
that can stimulate that blood flow to the
right
extremities.
Right. Yeah. And so, and because some people don't like some of the systemic, like they feel maybe too flushed, or I've actually had some people where they felt like they had just it affected like the way that the feeling in their chest, or like
kind
the
of
breathing, just too much. And so, being very local sometimes can be helpful, so you don't get those systemic side effects from the medication.
And there's some herbs that are supportive as well of the overall male hormone. So things like Rhodiola is great. That is a great herb for men or women. Tribulus is a really nice one for supporting that overall male health and libido. Maca. Love maca. And then some hormones like DHEA or...
This converts into estrogen and testosterone. So we do have to kind of watch that one.
And of course, bioidentical testosterone replacement. So.
Right. Yeah, if it's needed, and we can definitely some good potential like correction or help with that area when that's optimized. So, well, I think that's probably about it for today.
I know we could go on and on as always, but I feel like we covered a couple of really good, important topics for you men or
ladies
women who are watching.
Your men.
Please share it with the men that you
love.
That's
right.
And encourage them to get into the doctor if they haven't been for a while.
Yeah, absolutely. And so thank you so much for joining us. Please don't forget to like, follow, and subscribe below, and we look forward to seeing you again.
Thanks a lot.
Okay, bye.